Hey guys, we're going to start with axial skeleton. We'll run through it pretty quick. Um, you'll need to know the skeleton and the muscles are hard because there's a lot to know, a lot of landmarks on the bones, a lot of holes in the skull, different things like that, a lot of muscles, attachment, insertion, all that kind of stuff. So it's just a lot of material to go over. Um, but we'll breeze through some of this to give you guys some things to focus on. Okay, so there's two different skeletons. Okay, we have axial skeleton and the appendicular skeleton. So the axial skeleton consists of the skull, okay, and the vertebra and the sacrum, and then also the ribs and the sternum. Okay, we also have some accessory bones, which we'll look at too. We have the ossicles in the ear and then the hyoid as well. So we'll look at that in this PowerPoint. So we have bones of the face, okay, 14 bones of the face, which we'll look at in a couple different views from in the next couple slides. And then we have the 8 cranials. The cranials, those are basically the ones on the outside here, the frontal, parietal, occipital, temporal, ethmoid, and sphenoid, which are things we've kind of already gone over. So those are the easy ones. And then we have a bunch of little ones in the face, which we'll go over too. Then we have the associated bones. We have the auditory ossicles, which we've already been over. And then we also have the hyoid bone. Okay, this is in your throat. It's the only bone in the body that doesn't articulate with another bone. Okay, so that's kind of suspended by muscles in your throat. Okay. All right, we also need to know the sutures. Okay, all the sutures where the cranial bones meet. Okay, so the sagittal suture here runs between the parietal bones. Then we have the lambdoidal suture here, which runs between the parietal and occipital. Lambdoidal suture. And then the squamous suture between the parietal and the temporal. Okay. And then from the superior view, we see the sagittal suture here, that lambdoidal suture between the occiput and the parietals, and then the coronal suture, or the frontal suture here between the frontal bone and the parietal bone. So coronal, sagittal, lambdoidal, and then the the squamous between the parietal. Here's a go in the squamous suture between the parietal and the temporal. Okay, squamous, kind of S-shaped there. Lambdoidal suture, kind of looks like a lambda from the back, and then coronal suture, like a crown over the head, and then the sagittal suture along that mid-sagittal line. Okay, so those are the sutures. We need to know the sutures, and then we just need to know all the bones. Okay, frontal, parietal, occipital, temporal. Okay, just like the areas in the brain. Okay, so we know those. The sphenoid is kind of in the middle of the skull, and we'll look at a couple of better pictures of that. But the sphenoid is here. Ethmoid, which we know has that perpendicular plate with the superior middle nasal concha, and the cribriform plate, which we learned about with the olfactory. Here we have the lacrimal bone. Okay, that's on the medial surface of the orbit there, okay, where the tears, remember lacrimal is like tears, so we have the tears that come and drain into that medial portion of the orbit, and so that's the lacrimal bone right there. Then we have the nasal bone, which is on the nose, the maxilla, okay, this is like right in the front of your face there, where the maxillary sinuses, when we get stuffy, those get filled up, maxillary sinuses. Okay, the maxilla also has articulates with our teeth here, and then we have the zygomatic bone. Okay, this is our cheekbone there, and we have the temporal process of the zygomatic bone, which goes towards the temporal bone, and then we have the zygomatic process of the temporal bone, okay, which meets the zygomatic bone. Okay, so we have that arch around the side of our face there, and then the temporal bone also articulates with the mandible. Okay, the mandible, we have the ramus here, that angled portion, and then the mentum in the front here, the mental foramen. Different portions of the skull there. We'll have a different view here. So here we can see more of the facial bones too. Okay, we have the vomer here, which we didn't see in the other view, vomer, and then we also have the palatine bone, which we'll see better in 2 more slides. We'll have a better view of that from a superior view. We can see the vomer, the palatine bones more easily. We have the maxillary bone here. You can see the maxillary on both sides, the zygomatic bone here, frontal bone, okay, temporal, and then we see through in the back here, right through the middle of the skull, this purple one, the sphenoid, which runs through the middle of the head. This one is going to be good for beginning to learn all of the holes in the head. Okay, so you got to know what goes through each of the holes and what the name is. Okay, so I can have basically in the practical, just circle one of the holes or ask what the name is, what goes through it. So most of them you'll find is cranial nerve 5, but there are a couple different ones here. So in the frontal bone, you have the supraorbital foramen. Okay, foramen is a hole, so supraorbital, above the orbit, foramen hole. Okay, that's the branch of the cranial nerve 5. Okay, and then we have in the sphenoid, we have a couple we can see from the front, the optic canal, which has the optic nerve, cranial nerve 2, then the superior orbital fissure, okay, which this has the nerves that control the eye movement, as well as the trigeminal nerve. So 3, 4, 6, and then 5. So 3, 4, 5, 6 through the superior orbital fissure. Then inferior orbital fissure, this is a maxillary branch of the trigeminal nerve. Okay, and that the maxillary branch then comes through the infraorbital foramen in the maxilla. Okay, infraorbital, below the orbit, foramen hole. Okay, below the orbit hole, and this is where the cranial nerve 5 comes through. Then we have in the mandible, the mental foramen, where the mandibular branch of cranial nerve 5 comes through. Okay. This is an inferior view of the skull with the mandible removed. Okay, so you can see through. So this portion is the posterior side. This is the occiput. Okay, anterior with our teeth and maxilla. Okay, so this is the foramen magnum. So the foramen magnum is the big hole. The occiput, that's where our brainstem comes through, or spinal cord. And that's where also cranial nerve 11 comes through as well. Okay, you can see here on the occiput, we have the occipital condyles. This is where the occiput sits on top of the atlas, okay, the first vertebra. First vertebra has the articular processes for the occipital condyles. Okay, so this sits on top of the spine. All right, so we can also see here a better view of the palatine bone and the vomer over here. And again, we can see the broad wings through here of the sphenoid that goes through the middle of the skull. Okay, and so we have the pterygoid processes of the sphenoid here. So muscles attached here, they help move your jaw. Okay, we'll look at those, the muscle section. Okay. So here you can see a couple more holes moving through the foramen magnum. You also have the jugular foramen. This is where cranial nerves 9, 10, and 11 go through. And then with the temporal bone, you can see the external acoustic meatus. Okay, and that's the ear hole. And then the carotid canal and the stylomastoid foramen. Okay, this is a styloid process here. Okay, stylomastoid, it's the mastoid process. Stylomastoid foramen. So it's between the styloid and the mastoid process. And it's a hole. And that's where the cranial nerve 5 comes out. Okay, and then with the sphenoid, we can see 2 different holes underneath here. Foramen ovale, which is cranial nerve 5, and then the foramen lucerum, which is the internal carotid. So these are good for flashcards, learning all the holes and what goes through them. Okay, that's just a different view. I don't need to look at that really. Okay, again, different view from superior view, okay, with the top of the head cut off here. So we see the greater and lesser wings of the sphenoid here. And we see this circled portion here. Okay, this is right here. Okay, so this little dip here Okay, this is called the cella-turcica. So this is a sphenoid, and this little dip is what's circled in this other one. Okay, so the dips down, cella-turcica. This holds the pituitary gland. Okay, so that's an important landmark for the pituitary, is in the cella-turcica of the sphenoid. Okay, we can also see the ethmoid bone, the cribriform plate, or the cristagalli, and the cribriform plate of the ethmoid bone. And then, so we know that through the ethmoid comes that olfactory nerve. And then the different holes here, we have the optic canal, which we talked about. The foramen rotundum is an additional one that we can see right here, and that holds cranial nerve 5. The foramen lucerum we talked about, ovale, and then the foramen spinosum. This is just blood vessels that go through here, foramen spinosum. And then we talked about the carotid canal, and then we see the internal acoustic meatus from this view. Okay, so that's cranial nerves 8 and cranial nerve 7. All right, then occipital bone, we talked about the foramen magnum and the jugular foramen, and in this one you can kind of see here the hypoglossal canal, which is hypoglossal nerve, so that's cranial nerve 12. So go over all of the different bones, all the different holes, make the flashcards for that. This is a slide that shows the sinuses. I'm not sure if I'll have a question on the sinuses on the practical, but we did last semester when we were actually in the lab. So knowing we have the sphenoid sinuses here. So sinus is just like an air pocket. It's just a cavity in the bone. Okay, so we have the sphenoid sinuses, and we have ethmoid air cells within the superior and middle nasal concha. Okay, we have little holes, so those are the air cells. And then we have maxillary and frontal. So frontal, right here, you can see that, and then the maxillary, well, this is cut. So the maxillary is in the maxillary bone. Okay. So understanding which bone it's in helps you name it. Okay. All right, and then there's the infant skull. We talked about how the flat bones of the skull use intramembranous ossification. So we see that there's still soft spots, okay, where the membrane is not fully ossified. And this allows for the growth and development of the brain to be able to grow, especially towards the frontal portion. Okay, the anterior fontanelle is the last one to close here, so it allows for growth in the frontal portion of the brain. But they have different fontanelles. Okay, so there's the anterior fontanelle and the posterior fontanelle. Okay, it's just a larger area meeting of the different sutures. Okay, so there's a big soft spot, fontanelle, anterior, posterior, and then the sphenoidal fontanelle near the sphenoid, and then the mastoid fontanelle by the mastoid process. Okay. So you're familiar with those. All right, so let's talk about the vertebra here, vertebral column, the spine. Okay, so we have seven cervical vertebra, 12 thoracic, 5 lumbar, and then we have a sacral segment and a coccygeal segment. Okay, so when we look at the spine, we see we have a bunch of front to back curves. Okay, a side to side curve is not, we're not typically designed for that. That's an abnormality. So we look at our front to back curves that we're born with, and then which are primary curves, which we're born with. Okay, that when we see an infant, they're always kind of curled up in that C shape. Okay, so we have the C shape curves that remain are the thoracic curve here and the sacral curve. Okay, these are our primary curves. And then as we develop, as we start to lay on our belly, get on our hands and knees and start to crawl, we hold our head up. Okay, and as we hold our head up, we develop all this musculature in the back and start to develop a secondary cervical curve. Okay, so the cervical curve is a secondary curve. And then as we move to sitting up and standing, okay, that's when we develop this lumbar curve. Okay, so the lumbar and cervical are secondary curves, thoracic and sacrum are primary curves. Okay, and we'll look at each of the vertebra individually, and we'll need to be able to identify C1 and 2, the atlas and axis. Those are unique vertebra, but then you have cervical vertebra, which look different from thoracic, which look different from lumbar. Okay, so we'll look at the differences there. So you'll be able to identify the structures on the specific vertebra, like the body and pedicle, lamina, that kind of stuff, as well as what segment of this, what section of the spine it's from. So we could point to a pedicle and ask you to name that portion of it, and then ask what vertebra, where the vertebra is, cervical, thoracic, lumbar. Okay. So in general, here we go. There we have the vertebral arch here, the vertebral body, and then the articular processes. Okay, so vertebral body can be smaller or larger depending on where it is in the spine. But then we have the vertebral arch, which is made up of the pedicle and the lamina. Okay, and where the lamina and the pedicle meet, we have a transverse process. And then where the laminas meet, okay, we have a process, a spinous process. Okay. We also have on the superior and inferior aspect, we have articular surfaces. Okay, this is where one vertebra meets another vertebra. Okay, and then in between each of the vertebral bodies, we have an intervertebral disc. And the hole here is a vertebral foramen. That's where the spinal cord goes through. Okay, the spinal cord goes down through here, like this arrow. Okay, that's the spinal cord. And then out these little holes, in between the vertebra, the intervertebral foramen, that's where the spinal nerves go out. Okay, so we have the spinal cord going down, and then at each segment, each level, we have the spinal nerves exiting at the intervertebral foramen. Okay. So the atlas and the axis is on top, the axis is on the bottom. Okay, atlas is C1. Okay, so in the axis, this is C2. Okay, so C1, this is right under the skull. Okay, so we have these superior articulating facets here, which cradle the occipital condyles. Okay, and the unique thing about this cervical vertebra is it doesn't have a vertebral body. Okay, so it's just a posterior arch and an anterior arch here with the transverse processes coming off here, and the transverse foramen, which is the hole in the cervical vertebra. We have transverse foramen. And that's a unique thing about the cervical vertebra. So the atlas sits on top of the axis. Okay, so you have the axis has these superior articulating facets which attach to the atlas. Okay, and you can see there's ligaments here which go around this odontoid process. It's also called a dens. Okay, the dens or odontoid process. There are ligaments here that kind of hold it in place. So the movement that's allowed in this is a lot of rotation. Okay, so most of the rotation you have when you move your head one way or the other, like sort of shaking your head no, most of that comes from this joint here, this atlantodental joint. Okay. So these are unique vertebrae here with the odontoid process. There's no vertebral body. Okay, there's just the anterior and posterior arch of the axis, and with the axis we have the odontoid process, and the posterior arch here with the spinous process. Okay. The rest of the cervical vertebra look similar. Okay, we have a small vertebral body, and we have short transverse processes with transverse foramen, a hole here. Okay, then we have also a bifid spinous process. Okay, so the spinous process doesn't come to a point like with the thoracic and lumbar, it comes to 2 points, bifid. Okay, so it's split. Okay, so that's the cervical vertebra. And then thoracic vertebra, we have a little bit bigger vertebral body. We have longer transverse processes with articular surfaces for the ribs. Okay, so these are costal facets. All right, so the ribs come in and attach to the transverse processes here, and then ultimately attach into the part of the vertebral body. Okay, so we'll look at that in a little bit. And then the spinous process is a lot longer and larger. Okay, so large transverse processes, large spinous process, okay, and articular surfaces for the costals, the ribs. So the superior costal facet, transverse costal facet. And then with the lumbar, we have a lot bigger vertebral body, smaller vertebral foramen, a shorter transverse processes that go straight out, okay, and then a shorter spinous process as well. Okay, so be familiar with the structures of each section in the spine and then the specific landmarks on each of the bones there. Okay, moving on, we have the sacrum. So this is the sacrum. We have the base is at the top and the apex is at the bottom. Same thing with the coccyx. This is the base and this is the apex. The apex is down. Okay, with the sacrum, we have the sacral base at the top. We have the sacral promontory. Okay, this is where the vertebra, the vertebral body, the intervertebral disc sits on top here. And then we have on the posterior side, we can see the articular processes that meet the L5 vertebra here. On the front, we have the ala. Ala is like wing, so we have the wings on the front, the ala. And then we can see the holes here, the sacral foramina. And there's usually transverse lines that you can see within where the vertebra kind of where it all fuses. Okay, when you're an infant, this is not all fused, so it fuses later on. So you see these transverse lines where it has fused. Okay, you can see the broad articular surfaces right here, and so that is that attaches into the ilium, which we'll look at in the appendicular skeleton. So we have also on the back side of the articular surfaces, we have the sacral tuberosities. And then we have the medial crest in here, and the lateral sacral crest on either side here. And we do have canal here. So it's, whoops, we have the sacral canal. Okay, this is the entrance here, and the hiatus here. Okay, so there's a hole in there. All right, and then we have the coccygeal cornu, which cornu is like horn. Okay, with the horns and the coccyx, and then the base and the apex. And not much of the coccyx there. Okay, then we'll talk about the ribs. All right, so we have, let's start with the sternum. The sternum has three different parts. The manubrium up here, then we have the body, which is the long portion, and then at the end we have the xiphoid process right at the end here. Okay, you can see that the manubrium attaches to the clavicle as well as ribs 1 and 2, and then the body attached to the rest of the ribs attached to the body here. Okay, you can see this red portion here, I guess it's red, is cartilage. So this is cartilage. So the ribs don't actually attach all the way directly into the sternum. We have the costal cartilage that attaches into the sternum. Okay, so this, the first 7 ribs are true ribs. You can see because they come in and they attach with their own individual cartilage into the sternum. Okay, 6 and then 7, and then from 8 to 10, the cartilage meets up with the cartilage of rib 7. Okay, so these are called false ribs. And then we have 2 floating ribs that don't have cartilage. Okay, you can see better on the back here. They just don't have cartilage. They don't attach, they just float. Okay, 11 and 12 are floating ribs. Okay, and then last slide here. So we can see the structure of the rib. We have the head and the neck. So the head attaches into the vertebral body here. We have the neck and then the tubercle of the rib, which attaches to the transverse process of the spine. And then around here comes the angle of the rib. Okay, this angled portion is called the angle of the rib. And then that goes to the costal cartilage junction, where it meets up with the cartilage, which then attaches into the sternum. Okay, and you can see on this view, this little groove, the costal groove, is on the inferior surface of the bone. Okay, that costal groove is where the blood vessels and nerve run. So that goes along each nerve underneath on the inferior surface. Okay, So when we're orienting ribs, we put that on the bottom, the angle towards the back, and we can figure out what side of the rib, side of the body it is. But okay, so that is the axial skeleton, and we'll do another quick one for the appendicular skeleton, and try to finish up with muscles and joints. Okay.